talking about pulmonary AVM. So if sometimes they are so big and they have so many collaterals that it's not possible for the cardiologist or interventional radiologist to close these. So I'll share a few cases that how, with the help of a team approach, we sit together, decide what is best, and then we do the best. So here you can see this is a AVM. He was a 10-year-old child. AVM on the right side. So here you can see there was a huge AVM and there are multiple feeding vessels. So we had a discussion with the cardiologist. He said that it will be very impossible to have closure of all the feeding vessels and huge tortuous collateral vessel. So what we did was, we did a pulmonary angiogram, and from the pulmonary angiogram we first did a 3D imaging and we saw in detail from which vessels this AVM is getting fed. Because if you go blindly, if you go enter the chest through a thromboscope, and if you don't know from where the feeding vessels are coming, then you may land up with disaster on table. So once we were sure, then here we entered through the single port, and here you can see this is the huge AVM, and just if you touch it, it started bleeding. So like if we have to remove it, there was risk of rupture on table. So what we did was that we had all the 3D images, and we knew we had to save the pulmonary artery supplying the lower lobe, and we had to resect this. So this was like more or less near the fissure, and here then we saw this is the fissure, and then we identified the pulmonary artery going to the lower lobe. We had to save that, because if while doing the resection, if we ligate the pulmonary artery also, then the lower lobe will be gone. So what we did was that we did a segmental resection of the entire AVM, and here you can see we have preserved the upper lobe, the middle lobe and the lower lobe, and we have removed the AVM without compromising the blood supply to the lower lobe. So here there is another lady. She was a mother of a doctor, and this was during COVID. So she was an elderly lady. She had a history of COVID also, and X-ray showed there was a huge AVM on the left side. And here you can see this was being fed from the left side, and it was really huge. And we discussed with the cardiologist, because this was not a very good case, keeping in mind that the patient already had COVID and elderly lady, so surgical risk was little higher, risk of anesthesia, etc. So then the cardiologist thought that we are not able to close by a normal device, so they inserted a ASD closure device. So here you can see this is a ASD closure device with which this was a huge AVM, and you can see on the other side this is a device closure done, and after the device closure this is no longer filling. Here it was filling like this. On the other side you can see it is not filling anymore. So normal supply to the left side lung you can see, and the AVM is totally closed. So these are two different kind of patients, and with team approach, like we decide which would be the best for the patient. So this is the follow-up X-ray after 2 years. Now we have a follow-up of 2 years, and this is the X-ray. We can see the device, but there is no AVM, and patient is healthy.